Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Ptosis, we are focusing on the types and the surgical treatment. So, the first kind of surgery will be the fascinella. So, it is a fascinella cervet. So, the fascinella cervet surgical treatment. So, here the requisite levator action. So, here it is good. The amount of ptosis that can be treated will be less than 2 mm. So less than 2 mm, and the indications include the Horner syndrome. Next is we move on to the levator resection. So here in levator resection, this is the anterior approach. And that is nothing but the Everbush operation. So here the requisite levator action is going to be moderate. And the amount of ptosis that can be treated. The amount of the ptosis that can be treated is going to be any amount, and the indication is going to be the larger resection of the ptosis. So there is larger resection of the ptosis. Next is we move on to the levator resection. So this will be the levator resection of the conjunctival approach. So levator resection, anterior approach was the Everbush operation, and in terms of the conjunctival approach, it is going to be the Blaschkowick operation. So the requisite of the levator action, this is again, it is going to be moderate, and the amount of ptosis that can be treated is any, and the indication is the moderate resection on the ptosis, whereas levator resection anterior approach was for the larger resection. This is for the moderate resection of the ptosis. Then we move on to the levator resection with the aponeurotic reinsertion. So there is a levator resection. This is the aponeurotic. So there is aponeurotic reinsertion. So here the requisite of the levator action is going to be moderate. So this will be moderate, and the amount of ptosis that can be treated is going to be any. And what is the indication? Indication is the acquired ptosis. There is acquired ptosis. Then we move on to the surgery. In terms of surgery, the frontalis suspension, you see. So there is a frontalis suspension. So frontalis suspension, it refers to the fascia lata. So here the requisite for the levator action is going to be poor, and the amount of ptosis that can be treated will be greater than 2 mm. The fascinella cervet was less than 2 mm, and the other levator resections didn't require any amount of ptosis, it was any. And then the frontalis suspension, that is the fascia lata, it tells it is greater than 2 mm. Now the indication here in terms of the frontalis suspension is going to be the congenital ptosis. So it is a congenital ptosis, and also the Marcus gun ptosis. There is a Marcus gun ptosis. To learn and grow daily like this, please do subscribe.